prostate cancer is the most common cancer in men in the UK, and because it develops slowly there may be no signs you have it in the early stages. Symptoms often become apparent when your prostate is large enough to affect the tube that carries urine from the bladder to the penis, the urethra. As a result, the majority of prostate cancer symptoms are linked to urination, according to Bupa. One sign to look out for when you go to the toilet is being unable to urinate. This is known as retention. Other symptoms of this type of cancer include needing to urinate urgently, needing to urinate more often than usual, getting up to urinate during the night, having blood in your urine, pain when you urinate, having a weak flow of urine when you go to the toilet, and having trouble starting or stopping when you urinate. If the cancer has spread outside your prostate, other symptoms can develop, says the health organization. These include having difficulty getting an erection, feeling tired and generally unwell, having pain in your bones or your back, and losing weight. The PSA test is the best way to find out if you have the disease. The first stage of the process is a simple blood test. A rectal exam can then help identify obvious abnormalities on the surface of the prostate, even if the PSA is normal. Professor Hashim Ahmed, consultant urological surgeon at the Bupa Cromwell Hospital, explained, if you have a raised PSA or the rectal exam shows a lump, your doctor may refer you for an MRI scan in a specialised unit, which is a much more effective way of detecting prostate cancer. He added that it's important to note that your PSA can be high if you have prostate cancer, but it can also be higher than normal if there is an infection, inflammation, or you have a large prostate. Recent sexual activity before the test or cycling due to the pressure from a saddle can also raise your PSA levels, so make sure your GP is aware of anything that could affect the test. But if you need a biopsy, does it have to be through the back passage? And does it hurt? Dr. Ahmed said, a biopsy check for prostate cancer involves taking tissue samples from the prostate. Some expert centers now only biopsy the prostate if the MRI shows suspicious areas. One of the common ways to biopsy the prostate is through the back passage, called transrectal ultrasound biopsy or truss biopsy. This procedure takes about 20 to 30 minutes, and your doctors can discuss the biopsy and the side effects. Some urologists now biopsy the prostate using the transperineal approach through the skin behind your scrotum. This is a cleaner approach that is more accurate, but it requires sedation or general anaesthetic to carry out. Many men could confuse an enlarged prostate with one of the symptoms of prostate cancer. But how can you tell the difference, and are you more likely to get prostate cancer with an enlarged prostate?